Hello, everyone. This is Hossein Mokhtarzadeh, and we want to talk about ACL injury. I'm more than happy to welcome Professor Evangelos Pappas from RMIT. He's RMIT's inaugural professional research fellow, director of MedTech Research and Innovation Hub, and professor of Musculoskeletal Health. He's done a lot about ACL, so we're going to hear more and more today. So his research utilizes epidemiological, biomechanical, and clinical tools for preventing and treating anterior cruciate ligament. If you don't know anterior cruciate ligaments, there's a ligament in your knee. And interestingly, it doesn't take much time to tear it. It's just, I guess, like less than a second, maybe 40 milliseconds. You can just jump and come down and done. And why is it going really increasing these days, despite all the research that we do, all the uh, kind of educational programs that are out there? It's still increasing, Professor, right?
First of all, thank you for the invitation and great to be here, Hossein, with a fellow ACL nerd. I know you've done a lot of work in this space, so I'm
Pleasure.
really looking forward to this discussion today and speaking about ACL more broadly. So you're correct. So the ACL, the anterior cruciate ligament, is about the size of the pinky finger, just a little piece of connective tissue in the center of the knee. It stabilizes the knee, so it stops it from moving too much, particularly the tibia moving forward. And the epidemiology, as you described, is very, very concerning. As a matter of fact, I will join you and maybe even extend it a bit and saying that ACL injuries are a public health problem for a variety of reasons. To a large extent, because they happen at very young ages. They very predictably lead to early post-traumatic knee osteoarthritis. So what we see clinically, and I have a physiotherapy background, is the 30-year-old patient with the 80-year-old knee. So they had an injury to the ACL when they were 15, 18, 20, and now, they're in their early 30s. Things are going well for them, starting families probably, accelerating in the professional career ladder, their progress there, yet their knee is really stopping them from enjoying life fully. We know that the risk for ACL injury is higher in females compared to males. Now, as to whether it is the ACL injuries are increasing, that is somewhat debatable. We do know that as an absolute number, there's more ACL injuries happening overall, but that's probably because of the increased exposure, meaning that there's more people playing sports that you can hurt your ACL. The basketballs and the soccers and the volleyballs and the netballs, again, very notorious for ACL injuries. So I think that's probably the main reason. Increased attention to this injury is probably another reason that you see more about this within media and social media. Now, the actual risk, meaning that if you do play 100 hours of basketball now compared to 10 years ago, are you at higher risk? Now, probably that hasn't changed much. It's still, the dangerous sports are still remain the dangerous sports for knee, and the cycling and swimming still remain very safe. But what really matters, and I think that goes to the crux of your question, is that there is a lot of ACL injuries and that we're seeing an increased number of ACL injuries, even though the risk probably hasn't changed, particularly among females. And more concerning is that it happens in the young ages. So when we look at the epidemiological studies, the highest increase in the number of ACL injuries are in teenage girls. Again, which means that they have to live with the consequences of this injury for much longer.
Yeah, it's really concerning, and it's great that you mentioned the public health issue that sometimes it's not really highlighted out there that okay, this simple injury, not simple, just quickly happens to someone in just less than a second, and then 9 months or 1 year they're out. And it's not just the injury, musculoskeletal injury, then the psychological and other issues if they are playing in high level and then they cannot go back to it. And once you probably mentioned somewhere that, if you got one injury, then the risk of the other injury will be more than 10 times or 16 times. This is a huge numbers here, and probably it's great that you mentioned that absolute number increasing, but it seems that we're not catching up, right? In terms of like the research we're doing, application we're doing, how can we really go hand in hand, at least try to, you know?
Yeah, no, that's an excellent question, Hossein. The reality is that if we were successful, we would see that these injuries decreasing, and there has been quite a bit of an attention, at least, and sometimes even a bit of an investment in these in understanding what happens. Because not all athletes have the same risk for ACL injury. Obviously, you have to play the sports that are responsible for ACL injury, but even within those basketball, soccer, and netballs, there are athletes, and I think you mentioned that, who are at a much higher risk of suffering both the index ACL injury, the first one, as well as subsequent ACL injuries. So there are a few reasons why we haven't made as much progress as we would like. First of all, it's a very multifactorial, very complex injury, right? So there are contact injuries, meaning that there was direct impact on, particularly on the lower extremities, that caused the knee to bend in a certain way that breaks the ligament. There's not much you can do about that other than changing the rules. But what is promising is that a lot of these injuries the majority of these injuries is non-contact or indirect contact, meaning that they can be preventable. So the answer to your question is that we have not made as much progress, not because we don't have solutions. The injury prevention programs, and we've done quite a bit of work in our laboratory here at RMIT, but also many laboratories around the world. A lot of these injuries, particularly in females, can be prevented. So we can halve the risk of injuries with these very easy injury prevention, risk reduction programs that can be implemented instead of the traditional warm-up. So we have demonstrated, in multiple studies that these programs are effective. Then what's the problem, you may ask? It's that people don't do them. So coaches in particular can be quite resistant in implementing them, even though it's a win-win situation. Not only they decrease the risk of injuries, but also they improve performance. So in other words, and there was research that was done out of California that showed that the teams that do these programs win more because the athletes, become more athletic, they jump higher, they run faster. So it's not only the injury reduction benefit, but in addition to that, it's the performance benefits. But it does require, and that's probably where we should put our efforts. It requires, better advertisement for these programs. We had a PhD student when I was at the University of Sydney, who now is an academic at Victoria University, who has shown that the majority of the soccer players in New South Wales are not even aware of these programs. So only about 20% of them, they have heard of these programs. So we have to increase the awareness of these programs. And again, the same academic, Andrew Ross, he demonstrated the cost effectiveness of a nationwide injury prevention program. So if the government says that, well, I'm going to invest an X amount of money to implement these injury prevention programs nationwide, the return is going to be 3.5 times higher. So every dollar they spend, they're going to get a return in injury risk reduction and healthcare cost and productivity loss and all of that. That is going to be 3.5 times higher. Wow. So yeah, it is a no-brainer in many ways, as it is very frequently when it gets to public health prevention. Yeah. But as it is common, the problem with all the prevention efforts, it doesn't. There's very limited financial incentive, so it has to come from the government.
Yeah, I hear you. It's an amazing point that you put together. I also sometimes, forget myself the whole chain of it's not just the research, it's not just the, the team itself or the athlete or parents and the like, And I remember once I was reading the cost of just the surgery itself if someone got injured. It was like around 10K. Is it the same still, $10,000 or still much more than that?
The cost
The cost of like a surgery, like if someone got the
Yep.
injury and then going through the surgery, how much is that?
Yeah, it varies quite widely, actually, geographically, and whether you go down the public health path or the private. So it really depends. What I can share with you is that ironically, I tore my ACL
Oh yeah,
while
usually.
I was,
Case.
when I was in New York. I was doing my PhD at New York University, and just a couple of months before submitting my PhD thesis and playing
Sorry.
basketball, I hurt my knee at the gym
Oh,
at NYU, and I had surgery a couple of years later, and that was in New York, obviously very
okay.
high cost place, and the surgeon's fee alone was $18,500 US.
18.
$18,500
Wow, when
in
was it?
2007.
Wow, and you
So
can
that was at the
imagine.
hospital for special. Yeah,
I know, I know. Well, that's actually huge, and I'm sure it will be much more now. And we know that the
yeah,
U.S.
yeah.
system and all these challenges, other countries may not be as bad, but still, these numbers are not really showing up in parents. Like okay, because they send their children to all the kind of different gyms or the like, and it's amazing for me that why we are not really still doing much in that. So if you are now someone who has the authority, where would you put your effort?
On two areas. First, the injury prevention programs that I said, not necessarily changing them. I mean, obviously they can be improved. There is always space for improvement, but the ones that we have now are good enough. They're
Yep,
effective. It's just the dissemination and the wider implementation of those. That
correct.
would be one thing. The second, but still the reality is that ACL injuries will always happen. If you
Yeah,
play
yeah, yeah, yeah.
sports, there will always be athletes who get injured. We can certainly not completely eliminate them. So the second area where I would put my efforts, and I know this is close to your heart too, is at the return to sports phase
Yeah,
after an ACL injury, whether that was treated conservatively, and there is, particularly in Australia with the cross brace protocol, there's a lot of exciting research happening in this space, or surgically, with the traditional ACL reconstruction, where we have failed as a profession, and I put all the professions there, the orthopedic surgeons, physiotherapists, and so on and so forth, is assessing the biomechanics at the return to sports phase. And
yeah,
I'll take it a
yeah.
step back, Hussein, here.
Sure.
I was saying before that not every athlete is at the same risk of ACL injury, and there's many reasons that some are at higher risk. One of them is biomechanics. And we have done work on this, and others like Tim Hewitt and others around the
Yeah.
world, they have demonstrated that athletes, particularly females, who land with their knees in a knock-knee position, the knee valgus, for example, or who cannot control the trunk very well, right? So there are biomechanical risk factors that increase your risk of injury. So we know that. And yet, when somebody tears their ACL, they have surgery frequently if they, particularly if they want to go back to sports. Then we rehabilitate them. The swelling goes down, the strength goes up, the performance. We do all the return to sports rehabilitation protocol. Yet very rarely do we reassess the biomechanics before returning them to sports? And I think this is a missed opportunity, because if we identify the biomechanical deficits, and keep in mind that the risk, and you mentioned that earlier, the risk of re-injury is just gigantic, right? 16 times higher. I was just reading a study a couple of weeks ago that was published at JSAMS. More than 30% of those who tore their ACL from a cohort in Sweden, they had a surgery and then they retore their ACL,
Wow.
within a couple of years. So it is a major problem, and we know it's a high-risk population, yet we don't address the root cause of the problem, which frequently, not always, but frequently, is the biomechanics. So I would, and I know you've done tons of work in this space, I would put efforts in making biomechanics accessible, accurate, and be user friendly, so they can be implemented out in the field and in the clinic, so we can identify these athletes early on before they suffer a subsequent injury.
Yeah, that's amazing. I wish you know that how much I love to see these kind of things happening. Of course, and I know there are lots of people like yourself are doing great work out there, in terms of research and implementing from the clinical aspects of it. But there is something missing here, and you can see there's something, as you mentioned. Something came to my mind. Actually, it's funny that you said you tore your ACL just before your PhD or finish, and I actually tore my MCL before my.
Oh, maybe
It seems people
it's a
doing AC.
consequence of PhDs. PhDs
PhD.
are dangerous for your knees.
Yeah, maybe that's a cause and effect, right? But anyway, we know that we would love to continue, but I know that we busy at in like in 5-10 minutes. Maybe we can. I would ask you to maybe can come later on. We can extensively talk about all these details of it. We just touch base on some of the aspect, and I do hope people would take at least say, okay, I want to learn more about this. I want to like go because the information is out there, as you said, the
Mhm.
trainings and everything, and what you guys did, what Team Hood and all these people, amazing people have done. have shown that. They've shown that, okay, it works. Why it is not going there? Some part maybe, yeah, we need to go a little bit going and finding these kind of things. And I don't know, the coaches and everything, how they do it. I know I have been a coach and I know how challenging it is and in that particular area, that how you take care of the team and how you want them to succeed, but at the same time you want to implement something new and the resistance, we can see that. But anyway, so if you just tell us in 1 2 minutes something that you wanted to share, but I didn't ask you, I would appreciate that.
I think we touched upon most of the major topics here. Maybe, a couple of things, and again, I know this is very consistent with the work that you've done and many others, is that technology will give us a lot of answers. So I'm very optimistic about the future. We do start understanding a bit more who is at risk and why. We start, AI and some of the multivariable statistical processes that are being developed right now will allow us to assess the risk for ACL injury, by combining a lot of different factors. So I do think that we'll get better at identifying who may be at risk for ACL injury in the future, acknowledging that we start from a rather low baseline right now. We are, don't have a lot of accurate tools to predict who will get an ACL injury right now. But I think where a lot of exciting work happens, and we'll see more, is in the treatment of ACL injuries. So the cross-bracing protocol that I mentioned before will give another option for probably a percentage of the people who tear their ACL. Bridge enhanced repair that has been developed at Harvard University. I'm confident that it's going to provide better outcomes compared to the more traditional ACL reconstructions. So yeah, maybe the message is, don't shy away from playing sports. There's numerous benefits to doing that, physiological, psychological, sociological, and so on and so forth. I don't mean to repeat all that. The risk is there, so you need to be aware of it. And please speak to your coaches about implementing the injury prevention programs. They're quick, they're effective, and they don't require a lot of resources, and they may prevent you from suffering an ACL injury.
Oh, that was fantastic. I think just one thing I can add to it, if you don't mind, not only talk to your coaches, and coaches talk to you guys. Coaches also try to be updated. As we can't force, of course, but I mean, there's a lot. We know there's a lot of things out there that can help them sort of prevent. No zero, we can't just eliminate them for sure, because it's accident, it just might happen. But thank you very much, and hopefully we can continue this discussion. And to everyone, we talked to Professor Pappas and from RMIT, and hopefully you learned a lot about ACL injury, or at least be excited to go and learn more, and we hopefully can continue that one. Cheers.